No, okay.
Reproductive system today, right? So I hope my slides are visible to everyone. Yeah, yeah. So I'll just make it little bigger and presenter view. So here we are. So we'll start because we have 1 hour and I have to complete both the reproductive system in short and mainly highlighting you the main points on how yoga and reproductive system are correlated and why yoga teacher needs to learn about this system specifically. Okay, so in my lecture you will see I will be exploring on the topic reproductive system. Related means the anatomy, that is the structure part, then physiology, that is a functional part, and pathology, that is disorders part. Okay, and then lastly yogic healing techniques. Why yogic healing techniques? Because pathology, we can prevent the pathological disorder if we follow this yoga, and that is how we need to understand how to practice means yoga to keep our reproductive system healthy, both men and women. Okay, so that we will not have that disorder which will come in later our life. And when to start? Actually it is advised that as soon as women start menstruating at the age of average 12 to 13 year, the girl should be introduced with the yoga practices, right? So I hope this much background is okay and my language is understandable, so I can move further. Thank you so much. So these are the system which I'll be exploring. I have shown these two photos. This is female reproductive system and the other one is male reproductive system. Okay. Now let's see. Very important question. Everybody wants to, definitely everybody wants to enjoy sexual life. But do you know why human being is having, enjoy this sex? Is the one thing is, yes, why we want to have this sex? To enjoy. That is one answer which I am giving you. Now tell me why you want to have, what do you think about sex? Why human have sex?
To
You can
procreate.
just drop, that is, yes, yes. So you can drop down your answer in the chat box. What is your thoughts? Okay, that will give me a little bit more, understanding. What do you think about sex? Okay, so I'll read your messages and I'll continue my lecture. So there are, do you know, there are 230 reasons are there why humans have sex. But I'm not telling all of them right now. But yes, the important thing is what we should know is sex is for three basic reasons. One, what Sneha has just said, that to procreate or to reproduce. Okay. Then to experience pleasure, that is number two. And very, very important thing. What is that? To relieve sexual tension, to release the stress, because many of us, we are going through a lot of stress every time we are finding the partner, not only just to have a kid or just to produce child, but many times it is done for the releasing stress level. And that's how we can prevent ourselves getting psychosomatic disorder. Okay, but it should be used in a proper disciplined way. In India, we have these caves, and you might have, I don't know how many of you have visited. So these caves has the pictures of this, like having sex, two people, couple, threesome, foursome, lot of things you will see. But that doesn't give the different, perspective. We need to see this sex in a right perspective. Yes, definitely couple who are married who actually wants to have a child should be in their mind if they are wanting healthy child and want healthy pregnancy. That is other things, but the main things we have to understand the reason behind sex and disciplining. Where discipline comes, yoga comes into the picture. Okay, so yogic lifestyle, since we all are you are all going to become yoga teacher, so you should know the right reason behind the sex. other than just enjoying sex and producing child. Okay, so there are four purushartha which has been mentioned in our scripture. Okay, and they are dharma. First is duty. Duty towards what? Our body and our mind first. Okay, in Ayurveda these two aspects has been given more importance, so that Ayurveda and yoga goes hand in hand. And since I am Ayurveda doctor, I do, you know, what we think is self and non-self. These are the two things. In that self, body mind comes into the picture, and then the other thing which comes when we overcome our all stresses from this body and mind, we settle down ourselves, then only we are able to reach to our life, that is prana. The prana also one of the things which we learn in yoga practices, right? So then only we are able to enjoy our life, and after that we are able to explore our consciousness. So that's why yoga practice is needed. So duty towards body and mind, maintaining discipline, maintaining diet, proper diet. And also second thing is artha, means earning money. Money is also that much important. When you have body and mind absolutely working well for you, then only you are able to work, and then you will be able to earn money, right? And then after having two things, then you will be able to enjoy the third things in your life, that is kama, which is related to our subject today, reproductive system, right? Kama means desire or sex. Okay, two things. Your lot of we have desire. It's not only kama means only sex, it is also about other desires in your life. What do you want to achieve? There are so many dreams we have, right? To fulfill this dream we need this, the other aspect, that is body, mind and money. And after three things, then only we will be able to have that joy in our life, that is moksha, ultimate bliss, what we are looking for. Like in yoga we say samadhi state, you know, to achieving that ultimate bliss in life is very very important. So having understood all of this background, you know, this is very vast subject and very very important subject in our day to day life. That's why we need to look at reproduction, not only just having male and female meeting each other and conceiving the child, right? And this child grows in the womb 9 months, and then after 9 months there are many things which woman goes through, that woman only know. Every pregnancy, every, you know, every part of it, day to day, that woman knows what are the things are happening in her body, what are the fluctuations of mind happening in her body. So she should be a lot of, you know, develop, she should need to develop a lot of consciousness, and for that yoga in pregnancy also recommended. But before going to talking about pregnancy, we also need to look out the factor of before pregnancy, what are the things to be done, and how that woman's reproductive system can keep healthy, so that when she achieve this state of pregnancy and then childbirth, normal childbirth can be, you know, uh, happen, it will happen automatically. There will be no chance of having that, you know, cutting your tummy, like cesarean section, which is actually artificial way of bringing the child in this world. Normal, you know, yoga always sync in with the nature. So whatever the natural way of happening things, it should happen. And that is why we need to practice yoga, we need to maintain discipline. Okay, now let me just overview all my lesson. We will be talking about reproduction, we will be
Sorry,
understanding about the, yes, yes,
sorry, I have a question.
yes dear,
Hello, good afternoon.
yes, yes. Good
You
afternoon.
said that things according about pregnancy, they must happening naturally. I delivered my son with cesarean, and the reason was first he was very big, and second I have um, HPV, so I couldn't deliver him normal. So my question is, you said that because I was not practicing yoga back at that time. You said if I was practicing yoga and having more healthy life, which apart from yoga, I had healthy life, I think, apart from my stress. I can avoid cesarean? Because you talk about this. That's why I'm asking you.
Yes, yes, yes. That's what. Yes, there are many times it happens that there are
Depends.
many complications. There are many things happens last minute. I'm not saying every time we have to just look for only normal. Definitely, there are some issues which comes last minute, and doctor takes the decision to have a that cesarean. But most of the time, when you practice yoga properly from the starting and under the guidance of doctor and teacher, then definitely there are maximum chances even the complication can be turned into normality and normal delivery can be achieved. So
Thank you.
I think I'll take all your question in the end, and
Okay.
because then we will not divert and not spend
Yes,
much
thank you.
time.
I'm sorry.
Yeah?
I'm sorry.
No, that's fine. I'm glad that you asked me that question. That is absolutely fine. Yeah. So that's the way practically we understand there are some difficulty and we can overcome with the practice of yoga. So in the whole lecture, we will understand structure. We will understand what are the disorder which woman faces. Like we all are very much aware about PCOD and fibroid, and there are many kind of menstrual disorder. So all that things we will see, and also I want make you understand remember these keywords, that is reproduction, anatomy, physiology, human goals of life, gynecological disorder, and hormones, HPO. All these are the keywords which you will come across while we will have discussion over it. Okay. Now the first part, that is anatomy. Anatomy is nothing but the structure of human body, and I'm showing you both of the structure. And since I'm from Ayurveda background, there are a lot of factors will come in my talk, but I'll try to explain in even the modern science what modern science says. So this the whole land, this if we see our body or even our female reproductive system, this is actually our internal reproductive system. But you just imagine your body, easy to remember. Your body, this is our main trunk, so we can consider that this is our the uterus part. Okay, these two hands are playing the role of tubes. Though two tubes are there, so we can have consider that these are the two tubes. Okay, and this is the uterus part, and the legs part you can consider like this is the vagina, and then this is the cervix, opening of the internal body. And then with this two hand, two balls, you can keep it two balls in hand, so you will have the two ovaries. This is as simple as it is. Female reproductive system, just imagine yourself, see yourself in the mirror and see the part. So easy way of remembering this your parts of the body. So the first part is vagina. Everybody might be knowing this. We will explore more about what how cleanliness is important for the keeping. And in this yoga practices, yama niyama, that is the shaucha, santosha, tapa, swadhyaya, ishwar, pranidhan, or contentment, all those things, how we can maintain to keep our vaginal part healthy. Because once your entrance is clean, then you will be stopping all the infection right here, right at the door, right? Then the cervix part comes, that is the opening of the uterus. Okay, this is the cervix, that is the neck part of your uterus and the vagina. Okay, and this comes is the uterus inside, where exactly that baby stays after pregnancy. Okay, and these are the tubes, two tubes. We all have the two tubes, where the every month, and then at the end of the tube we have the ovary, where the every month one follicle get mature, and then it comes out from the ovary. And if we don't have sex or sex in fertile time, then it becomes the menstrual blood. In that month we have the periods. Okay, menstruation, that is the work which is going to happen. But in that we have to understand this uterus, the soil, where we can just consider our uterus like a land or the soil where we put a crop grows in that soil, right? So that soil should be healthy. So this our uterus part has 3 layers. Okay, internally, scientifically, what modern science says is our uterus is made up of 3 types of layers, and that layers internal part is called endometrium, middle part is called myometrium, and external part is called perimetrium. Okay, so endometrium is the inner part. You can consider if this is the uterus, hollow structure. The external part is the perimetrium, muscular part is the myometrium, and inner part is endometrium. So like that, the health of inner part, that is the endometrium, plays very important role during our menstruation as well as during our pregnancy. Even the continuation of pregnancy is healthier if this endometrium health is maintained, or the thickness of endometrium is maintained. And the myometrium is very important for the contraction and relaxation. And whatever practices we do, yoga practices, since our this uterus is comes under smooth muscle. If you know the types of muscle, then remember the smooth muscle. Smooth muscle has the ability of contraction and relaxation. And this uterus myometrium part plays that role. Okay. So the more our uterus is able to do these movements, it will be greater that the normal menstrual cycle, normal childbirth, and healthy uterine, complete health. And yoga plays very important role to maintain the tone of this muscle. Okay, so when you practice yoga, it directly acts on this part. That's why I'm explaining you more detail about these layers. Okay, if there is any difficulty like fibroid, this whatever the gynecological disorder, fibroid is related with myometrium. Okay, endometritis, the infection in the endometrium, that is related to inner layer. Or you might be having this disorder like menstrual disorder, like lot of menstrual blood is going, or less menstruation, so there is a problem in the thickness of endometrium. So we need to overall understood this structure in terms of understanding pathology behind it later on. So here the point is adequate thickness of endometrium is the key, okay, for our menstrual or the reproductive system health. Now let me divide this into 2 parts. Female reproductive system, one is external part and the internal part. What we have seen here we have seen the overview. Okay, laterally if you see this uterus, you will see the neighbor, the front part, bladder is there, back part, anus is there, and in between uterus is there. So you should know even these are the who are the neighbor of this uterus, so that they affects each other. Okay, we will see later on about this. Now let's see the external part. External part are the part which are visible directly to your eyes. Whenever you lie down with your both the thighs spread, the front part which is visible, and you will see these are the things: the clitoris, labia minora, vagina, this is the opening, and labia majora. What is the difference? What is the specific function? So how do you feel the sensation of sexual stimulation? Clitoris is the main part. These are the tissues, erectile tissues. If the massage is given to this clitoris part, you will feel more that sexual pleasure, or the feeling of that touch. Okay, then the opening, we know vagina. Labia minora is the place where it is a pinkish part, where there is no hairs. Hairs are not there in this part because lot of blood supply is there. That's why it is pink in color. Okay, and the side to that you will see the labia majora, which has hairs on it. Okay, so like that, these are the muscular part which is preventing our vaginal infection and preventing our external part. And then once the vagina internally, when we start the journey inside our uterus, just visualize it. This is first vagina, then the cervix, uterus, and again I am saying this. These are the fallopian tube and ovaries. Okay. Now, what is the size? Why I'm telling you size? Because just imagine 5 centimeter organ is having the ability to produce the human life. The complete reproduction is happening in this 5 centimeter place. Okay, and in that 5 centimeter, uterus has 3 centimeter, and even tube has less than 3 centimeter, 1.2 centimeter. That fallopian tube diameter is there, and our life starts from that place. And now, once we are out of this womb, we need so much big space to live. Even that is not enough for us, right? And that's why we need to understand our body, where exactly we have started, where we have established. And this place, we call it in yoga Swadhisthana place. Swadhisthana chakra is present in our this pelvic region, right? Swa plus Adhishtan, where we have the established, where we have first existed. And that's how we need to understand our reproductive system with philosophical background also. When we understand that we are here and we need very small space, then I think half the problem will resolve. Mentally and psychologically, it gives us a lot of broad perspective, right? So that's how this is the female reproductive system. Now we will just understand what is male reproductive system. Female reproductive system does the work of that, the taking care of our egg, the whole fertile period, before puberty, even after puberty, after menopause, what happens, that we'll understand in our physiology section. Here now I am moving ahead with understanding male reproductive system. Male are having very much complicated system, although their system is important for their sperms, because like we have eggs, male has sperms, and sperms needs to produce, then it has to be transported, and then it has to be deposited to the vagina. That is the three things which sperms has to do, right? So before that, that's why they have the long transport system. It is basically transport system. One is production, though they have the testis, like we have the ovary, they have testis. Above that testis, they have the sperm storage. Okay, and that storage is called epididymis. Here I have named it. And then from here, mature sperms comes from this duct. So the second internal structure is duct, and from that duct, at the time of ejaculation, this sperms get squeezed out from this penis. So the visible part, there are only two visible part. One is penis and one is scrotum. And under the scrotum is the cover. Like we have mobile cover, similarly they have testis cover, that is called scrotum. Okay, and internal part is duct, and then for this duct is nothing but the transport system, and that sperms need some nourishment. Okay, sperms has to survive because they have to travel a long distance, and again entering into vagina is another challenge for them, because vagina has a lot of heat, lot of acid. Okay, and although our system makes alkaline at the time of fertile period, alkaline system has been formed, but sometimes the sperms needs to survive and overcome that, and then goes inward, that is in uterus and then fallopian tube, because fertilization occurs in the fallopian tube and not in uterus. So sperm has to travel long journey. That is only things we need to remember. And for that purpose, inside male reproductive system, they have glands. And the glands, there are three glands, that is seminal vesicle, prostate gland, and bulbourethral glands. Okay, and after that we will see how this even the important reproductive system which has been kept very nicely. Okay, very nicely in the bony aspect. Okay, yes, we will have Q&A definitely. So the bony aspect, these bones which is male and female related bony structure are like this. Female pelvis has this wide structure, because the pregnancy, she needs a lot of expansion of this uterus, the as per baby's growth. Okay. And then later on, male has this the narrow pelvis. Then they have even the sacrum and the tailbone is very much tilted type, like curved, so that when the pregnancy occur, that time it should not get pricked. That's why it is curved. But the male has this long and narrow and straight pelvic bone or the tailbone. Pubic arc, if you see this is what for the normal delivery we need to have that space. So pubic arc is 90 degree to 100 degree, whereas the male has this 50 to 80 degree. So this is what the difference between male and female structure. Now we will move ahead with the main functional part, physiology. So in this is the summary which I am giving you about the physiology. Main physiological part starts from the puberty. What is puberty? When women start her first menstruation, that is the menarche. Okay. But the girl born with whatever the stock of her eggs are present at the time of childbirth, girl childbirth, but it takes time, at least 12 to 13 years, to mature that eggs inside her body after getting ahead in her life. And that time comes the puberty or the menarche. And since then, ovulation process starts. Ovulation is the first physiological function happens inside our body, okay, at the time of puberty. Then later on, ovulation, after ovulation, there we see that menstruation is the second thing. First is ovulation, second is menstruation. If we have intercourse, then only we have fertilization, conception, pregnancy, and childbirth process. Then that time menstruation is not present during the pregnancy. Okay. So there are two important things which occurs after puberty. When the girl gets mature, her body gets prepared for the having child. But it is advised that she should marry at the she should marry and carry the child only after 18 years of age, not before that, because her whole body is still under the construction. So we are not living in the home which is under construction, right? We do wait for having that home completely uh, ready. That's how our whole body or the reproductive system also needs the time to again being capable of continuing the pregnancy. Okay. Even if the puberty or the menarche happens at the age of 13, it is advised to have that conception or the intercourse after 18 years of age, which will be making your reproductive system healthier and your baby also healthy. Okay. So these are the two cycle which starts after puberty. One is ovarian, one is menstrual cycle. And when this cycle is ceases, when our menstruation stops, that time is our menopause. And it is not the end of life. Many women suffer in menopausal disorder due to thinking that my life is ending now, but it's not. Okay. Now let me give you the clear idea what happens inside the ovary and who are responsible for that. Okay. uh, so this is our ovary. Okay. We have two ovaries, like we have understood, and in that ovary we have small eggs which are present, and all that eggs are under the construction, like I said. And each month one ovary turning into, means the from the primary follicle, it becomes the secondary follicle, then it becomes the the follicle which is mature. After maturing, it comes out. Okay. And this happens under the influence of hormones inside our body. And these hormones are nothing but it is getting order from our brain. From brain to our reproductive system, there are some message is going on. Okay, that's why yoga also plays very important role for giving that the proper message or neuroendocrine relationship, building neuroendocrine relationship, building neuromuscular relationship. You might have been hearing this word again and again in anatomy and physiology. Keep these keywords in your mind. Okay, neuroendocrine relationship, neuromuscular relationship. Okay, neuro means brain, endocrine means your hormonal system. I think last time I have taught that endocrine system, all the hormones in the body. And neuromuscular means, neuro means brain, right, your nervous system, and muscular means your muscular system. Okay, so your, like we have understood that uterus or reproductive system is nothing but it is a smooth muscle. So the effects of yogic practices happening inside our reproductive system with this, correcting this HPO axis or neuroendocrine system and neuromuscular system. Okay. Now, moving ahead, I hope you have understood this. I'm not going in detail, but just to tell you about HPO axis. Remember, H stands for hypothalamus, which is the, the important gland which is present inside our brain, which gives order to our organ. And the main, it gives order to the gland which is called pituitary gland. P stands for pituitary gland. Okay, and then HP means hypothalamus and pituitary gland. These work together and they acts on our reproductive system. Okay, and that's how our ovary reproductive system is. This ovary is getting maturing because of this instruction of hypothalamus and action of pituitary gland. This ovary, inside ovary, egg is maturing. After maturation of egg comes out, and this egg has been now forwarding, means taken by the tube where the fertilization occurs. Or if fertilization doesn't occur, then the menstruation starts. This is the menstruation which every month we experience. We all have every month this cycle, if there is no abnormality, if we are not suffering from any disorder. So this is how the whole hormones are responsible for making this happens. If we do not have sex, then this egg is waiting for some time in the tube. If the sperms doesn't come, then egg become dead, and then the endometrium lining, which you are seeing here in the red structure, red color, that is also, thinning out or shedding out. Okay, with this dead egg. So our menstrual blood has dead eggs as well as the parts of endometrium, because endometrium has lot of blood supply. Okay, lot of blood network are present in the endometrium, and so the thickness get reduced. Okay, now I hope you are understanding why I'm talking about these layers again and again, because that is playing very important role to make our healthy reproductive system. And then what yoga practice should I do during menstruation, or should I practice yoga or not during my menstruation? How does it help me for keeping the health? So my answer to that questions are that what Ayurveda thinks is, or what yoga thinks is, be in sync with the self and avoid exertion. You know, don't do any advanced practices during menstruation, because see, if this is the natural things happening, natural biological process is happening. If you exert, what will happen if you do topsy turvy asana during your flow? So it is, flow is happening towards the gravity, and if you do topsy turvy asana, this blood can go back, you know go back towards the tube, then towards the ovary and even peritoneum region, and this may create a lot of later on problem. Okay, and also, since our, this is the wounded womb, we say in Ayurveda, there is a wound inside our our reproductive system or inside our uterus. So how we take care of wound? If we have outside, we do dressing, we apply some ointment, right, till it will heal. So we are taking care of that wound so consciously. We should also take care of our inside, wound consciously, by remaining silent, by following yama niyama, cleanliness, modified version of asana like do shavasana, do pratyahara. Don't get attracted towards all these external attractions or distraction. Even in Ayurveda said, don't see your husband during those times, because you may get stimulated, and it is contra. First 3 nights don't do sex when you are menstruating. No? So this much has been explained in our shastra or in our scripture. But yes, you can practice your dharana. Focusing on your swadhisthana chakra is very important, because you are attending your wound. So you are respecting, you are not disrespecting that part, which needs a lot of attention during your bleeding time, during your menstruation time. Most of your body energy is directing towards pelvic region, right? So focusing on that part is very, very important. So silence, maintain silence, do dhyana practice during menstruation, and don't take any action oriented plan. Don't make any action oriented. Don't travel, don't move. Maximum take rest as much as possible. That is required, and that is also yoga. Yoga is not only making your hands and limbs up and down. It's more than that. Okay, so that is yoga which I suggest mainly. Okay, now let me tell you about this cycle. Imagine that normal cycle, many of us know that 28 by 5, we say that 28 days the interval between 2 periods, and 5 days is the bleeding time. So if we assume that, so the day 1 to day 5 is the your menstruation time, right? So it is mainly the lot of movements are happening. That's why you need to cope up with all those movements. Give rest to your body. That is required. That is number one. Number two, after your menstruation, 5th day onwards, what you want to do, you have to have the excellent time in your life. Whatever you want to rock, whatever dynamic work you want to do it, you are allowed to do it. Okay, so post menstruation phase, just imagine yourself also. How do you feel after menstruation, 5th day onwards, when you complete your period time? What happens? You feel double energy, right? You feel excited, mentally, physically, both, right? So that is how our hormones are very much into the action or good things, because healed our internal wound is healed, and naturally we have kapha or the strength in our body. So day 6 to day 17 is very healthy. In that, day 10 to day 14, which is in green color I have shown in the slide, is very good if you are planning for your baby. So for fertilization, if it has been given this kind of education to the couple, when should you have a sex? If you are planning for baby, just give this alternate days starting from day 10 onwards. Alternate days they have to do the sex, then the maximum chances are there. And this way we hardly have 3-4 days in hand for the pregnancy. Other things is many times it is sometimes very rare cases conception happens, but maximum time is day 10 to day 14. Because why? Ovum is coming out from the ovary, and ovum is waiting in the tube for the sperm, and during that time if you do sex, then sperms comes and the fertilization occurs. Okay, and if you don't have sex, then day 17 onwards it is considered that the premenstrual time, means before your next cycle. How do you feel? What are the things, symptoms you have? Many of us have lot of irritation, sometimes headache, sometimes nausea type of symptoms, unnecessary tension, stressful things, fights, irritation, and we do not want to talk to anybody. Many stresses rises, even that is not stress, but we feel stressful, that is a premenstrual symptoms. Okay, before menstruation, next cycle. Okay, and then once your the day 28 ends, period starts, your all the problems get resolved. You feel good after you start your jumps, right? And this is how you are under the continuous under the influence of hormones. As per modern science, as per Ayurveda, we talk about the vata, pitta and kapha. So vata is during your menstruation time, kapha is post menstruation time, and pitta is pre menstruation time. Okay, I hope this much is clear. Okay, so I'll take your question answer in the end. I'm trying to finish this. This is now very important things. We have completed one physiology, that is menstruation. Now this is very important physiology. What all the women has been gifted with this conception, or when the sperm enters inside the vagina, goes upward and find out the where the ovum is. So this is the sperm and ovum meets and the fertilization happens. What we say is the conception. Okay, so that happens in the tube. Okay, here is the tube. This happens in the tube, and then after meeting in the tubes, that they both of them travel together and just establish inside the uterus. It doesn't grow here. If it is growing here, then it will not continue, because it needs a lot of space later on, growth and development. So we have uterus made for this. Okay, and that's how the conception starts. But in Ayurveda, there is another factor which has been mentioned, that is jiva. It's not only about the sperm and ovum, but it is about prana, it is about life, the third factor which is necessary to continue this pregnancy. So sperm, ovum and soul, we say. Okay, these three things should unite for the conception. Okay, now let's move ahead for the pathology. Now whatever we have talked about, menstruation, fertilization, these are all about the good things. Okay, everything is normal. We just assume that everything is normal, but there are not easy life we all women have, because we have the extra responsibility of conception or giving the birth to the life. So even women has a lot of other factors also, through which she is going through a lot of problems. Yes.
Yes, I'd just like to add to the group here. So, in your batch, there's nobody with probably reproductive issues, and it's good. But in the last batch, I had three women, out of which two had endometriosis. So they had this problem. That's why it's important to study and know about the reproductive system, so that hormone system and the reproductive, so that you can help them with yoga practices. Not they, like one of them had to avoid inversions completely because of that. So it actually made it better by avoiding inversions. So no headstands, no handstands for somebody suffering with endometriosis. So we had that. So this is why we are studying all of this.
Yeah, yeah. This is a very important point what Sneha has mentioned. Many times even we also not able to understand what exactly happening. Doctors are giving only hormone pills, but as a yoga teacher or yoga practitioner, we need to understand all this pathology behind this and how you can correct without giving pill. Simple modifying your diet, discipline and lifestyle plays a very important role. Now let me just talk about this, which is very important point for all of us. So we see that's why we need to understand structure. There are gynecological issues which we come across while practicing. There are some structural issue, there are some functional issue. Obviously they both are dependent on each other. If there is any functional deformity, there are definitely some structure has problem. If there is some structural deformity, there are effects on the functional. So the normal function, we know, menstruation, fertilization, conception, time to time, puberty, timely, menopause, all those things should happen. Events should happen on timely. But if it is not happening, then what? Then what is the problem? Why the menstruation is not coming monthly? It is a monthly event for all of us. But some women are menstruating after 2 to 3 months. Some women are menstruating complete full months. Okay, some women
I
are
actually, doctor, I have to tell the ladies, I have a young girl, 23-year-old, and you guys know that she was helping me with some things. So she, at the age of 23, because of stress, hasn't got period for 1 year. And now when she's paid relaxed, she got it after 1 year, and now again the problem has started that she's going back to Philippines. So this is a serious issue, reproductive system.
yeah, yeah. So yes, there are a lot of time, to explain this, but since we have less time, so I will just, give you overview. So PCOD, this is the 1 in 10 women it has been seen. WHO also gives the reason. There are PCOD classes going on nowadays. There are fibroid classes are going on. There are many, specialization under specialization is going on. So what is that? It's a high time to understand all those in depth later on, maybe. But let's see how we can just understand what is it exactly. So you will see here the PCOD means it is a full form of PCOD is polycystic ovarian disorder. Now here poly means many, ovarian means it's related to ovary, and cyst means it is a fluid which has been accumulated inside the ovary or the over the surface of the ovary, and that's why ovulation is not happening. What is ovulation means? Ovum coming out from the ovary. It is not happening, which is happen regularly on the 14th day if your cycle is of 28th day. 14th day, 14th day, ovum has to come out. Then only after 14 days it will turn into menstruation if sex is not happening. Okay, so that's why we need to have this normal cycle happening. Then if it is not happening, then it is due to polycystic ovarian disease. There are some metabolic disorder, there are some immunological problems, some infection like HIV. Nowadays we have COVID. There are some infections, sexual transmitted disease, partners to partners. If partners are not loyal to each other, they're having multiple partners, then they have sex. Somebody is carrying the infection in their genital organ, and then if you have sex with that kind of partner, then you will also get affected. Many times diabetic couples, if one partner has diabetes, they have a lot of the chances of having that infection. Then this couple should not do sex, or if they are doing sex, they have to maintain more cleanliness. We cannot prevent having sex if we are partner. Maybe it is diabetic or some other illness, but we can at least understand consciously how to prevent the complications, and how to maintain some discipline, extra additional discipline to prevent the disorders, right? So in India, many times the anemia is the common cause. For women, lot of women are suffering from anemia. Hemoglobin level is very, very less. That's why oxygen is not reaching to the cell. If your cell is not regenerating with this prana, that is oxygen, then definitely it will lack from all the nutritious food, whatever you are taking, but it is not reaching to your cell. And that is the problem which we need to target on. And these are some, that's why women suffer from many menstrual disorder. I have mentioned some terminology here. So first is amenorrhea. What is amenorrhea? It means no bleeding. Now no bleeding is only the problem when there is woman is in the middle age or after puberty, before menopause. And that time if she is not menstruating, then it comes under disorder. Otherwise amenorrhea is normal before puberty, because before puberty our system is not ready to start this bleeding, and after menopause it's already done the work, so it is normal. After menopause no menstruation is normal, before puberty is normal. Even during middle age, during her fertile age, during pregnancy we don't have menstruation, so that time also amenorrhea, that is normal, that is also not disorder. Okay, is it clear? So when it will be disorder, when woman is in her fertile time after puberty, monthly she is not menstruating, she is menstruating after 2 or 3 months. So what is the reason behind it? We need to find it out. Okay. Then second, sometimes painful menstruation, dysmenorrhea, severe pain. She is not able to, whenever she gets that phobia of, oh, my periods are there, that much pain some woman has. So even that is needed to find out what is the reason. Normally dull pain is expected, but more severe pain is not expected. Third is oligomenorrhea, means less bleeding, just spotting, not even having the one pad or two pad is getting wet with that bleeding. Okay, that is also problem. Then another case is opposite to oligomenorrhea, that is menorrhagia, heavy bleeding. One day, 2, 3, 4, 5 pads. That way you can just see and analyze what exactly things are behind this. And dysfunctional uterine bleeding means there is sometimes, in 1 month, twice you get periods. That is also not the normal function of the uterus. Normal is once in a month. Okay. Then the fifth one is leukorrhea, means white discharge. Leukorrhea, and this white discharge is the sign of telling you some other pathology, some like anemia, weakness inside the body. And now this leukorrhea is the person, the woman who is suffering from this leukorrhea, she literally needs to take pad for the white discharge, like she is taking in the menstruation time. So that type of things she may be suffering from. And the reasons are, these are the things: PCOD, polyps, fibroid, endometriosis, infertility. And the maximum complication is infertility, because not having child is one of the curse which we say that women been given. She doesn't carry, she is not able to become a mother, because that is the first thing which is expected from woman's life. But nowadays, since we have much developed, women are in career oriented, it's not necessary that to produce child is the first work. There are many other work also. But yes, it is important to take care of the health of your uterus, even if you want to become a mother or not want to become mother. But your keeping your body healthy is your first duty, right? And these are the disorder you will see. Endometriosis means the growing of endometrium, abnormal growth of the tissue, where endometrium should be inside the uterus, but it is growing outside. Fibroid, it is muscular disorder. Polyp, it is a tube, the bulb-like structure which is inside the growth of the endometrium, which is obstructing the blood, right? And these are the some blockages. So we can just understand whole this pathological or disorder according to, but the manifestation we will only understand with the cycle, average cycle, how the cycle is, what is the quantity of the blood, how many pads you need to take. Nowadays I have been practicing since 17 years, so I have come across many girls who are suffering from the oligomenorrhea. So only 1 or 2 days they are having menstruation, not more than that. And at the age of young, means 18 years young girls, they should at least bleed properly. 5 days at least bleeding should happen normally. But since our lifestyle had changed, there are a lot of junks in our body. There are a lot of input mentally also. We are taking a lot of bad things, and that's why yoga comes into the picture. Yoga always says that it is, you have to practice yoga before, before menstruation, during menstruation, after menstruation, all the time. Before pregnancy, during pregnancy, after pregnancy, before menopause, during menopause, after menopause. Yoga should be part of your life. You cannot escape yoga, because yoga is not only stretch and strength. Yoga is more than that. That is what I have quoted it, because many times in mainly Western countries, we consider that physically, what we do is yoga. But yoga has a lot of philosophical background. Unless you understand philosophy behind the practice, you will be not able to consume this yoga holistically. Okay, because yoga is holistic science, and it is you must know the philosophy behind all the practices. If you are doing Pavan Muktasan simply here, you should be in sync with where exactly pressure is coming, where it is, working on my part. So performing asana, understanding the meaning of that, part, your mind should be completely in sync with your body, in sync of the effects of that particular asana, right? Then it will be more effectively. Otherwise, just you are thinking something else, you are doing Pavan Muktasan, the effects of Pavan Muktasan will never reach to you. It will be partly benefited. So if you want holistic benefit, be there. Mind and body should be there and just see the result. Okay. So that is how we need to think yoga. And I have written here, before menstruation, what are the practices should be done? Because Ashtanga yoga, we follow Patanjali yoga. There are 8, things, limbs, which has been given yama, niyama. Unless you have that social, personal conduct clear, these are the foundation. Then you proceed further with the asana. Asana is one part of the, whole practices. Then the breathing practices. Then your sense organ practices. Pratyahara. Controlling your all this, going your sense organs towards the external object. Instead of that, you just need to do the effort to bring it again and again towards inward. That is what pratyahara, and it is a bridge between your external world and internal world. So once you just take control over these sense organs, then I think your life is in under control of yours. Oh, you are the own, you have remote control in your hand. Okay, and that plays very important role for keeping our reproductive system healthy. So all asana, I think you are learning under good teacher there. Practical asana, I don't need to speak about this. Mainly, I am just giving you that the vision or the perspective to practice asana in which thoughts behind this. And during asana, during menstruation, I have already explained what practices should be done in my last slides. So after menstruation, you are you can do all the practices, whatever the practices you are doing it. Advanced practice also you can do, but after and before, not during menstruation. Now, along with this practice, yoga practice, yoga also talks about the food habit, thinking habit. So when you are practicing asana, you have to have a light mitahara diet. Mitahara means what? The food which you like. It is not like food which you don't like. Okay, mita means which is I love to eat. That is mita. Mita means another thing is less. We eat that food which we eat that food more which we like, right? We don't eat food which we don't like. So again, here comes that your taste bud, you have to have a control over taste bud. Whatever food you like more, you have to have the, keep in mind, mitahara, light diet, less diet. Take it, taste it, have it, and just say bye-bye. Thank you. Namaste. Okay, that is one thing, mitahara. Then eat food which is having the most iron and folic acid rich food, like spinach, beetroot, because during menstruation blood is going out, right? So we have the weakness inside body. To cope up with that, we need to refill it, right? That's why we have to add the another factor. Since we are not able to do other practices, we have to add some dietary changes, and we should know which food I should eat during my menstruation. And it is also advised you have to sit to on the ground. How many of you means even lie when you sleep, you have to sleep on the ground as per Ayurvedic regimen lifestyle, because you are in sync with Mother Earth, because it's a gravitational, it is giving you safety, it is giving you that the comfort, and that is very good for the health. Okay, mind diet, I have already explained you how you should restrain yourself from getting into that under the influence of greed, anger, Okay, so better to avoid the contact. इसके लिए very easy things which has been explained in Ayurveda. Don't keep any meetings outside. Meet with yourself during menstruation. Meeting with yourself. 5 days do do meeting with self, and 25 days you are going to rock definitely. That is very important aspect which has been mentioned in Ayurveda. Okay, then lifestyle discipline. Sleeping is, or taking rest is very important part of our lifestyle. If we are just working, so you are making, you are not following your duty towards your body and mind, because whatever you are eating, it's going to digest only if you are resting. Give a pause. Very important, giving pause. Otherwise we are just, using this machine a lot. Overuse of this body and mind, so it will create problem later on, and then whatever you will earn from that continuous working, you have to pay to the doctors, and it will not become part of to enjoy the third purushartha, that is desires. You will not fulfill your dreams or desires which you want to do it with this work and money, right? So you need to take a pause. Okay, and that pause is going to increase your dose hormones. And pause is also, yoga teaches you to take a pause. When you do yoga practices or pranayama practices, just imagine what is the definition of asana. What Patanjali says, sthira sukham asan. So during menstruation, even your Ayurveda tells you to sit quiet, don't move. Sthira, sukha, comfortable. Without mother, means on the mother earth, you are very much comfortable actually. We are sitting on chair, we are sitting on couch. It is not actually comfort, it is man-made things. So being in touch with the mother earth is actually giving you that the feeling of being in this life. Okay, so yoga, Ayurveda, all these things are increasing dose hormones. What is dose hormones? It is happy hormones. Dose full form is D for dopamine, O for oxytocin, S for serotonin, E for endorphins. Now let me tell you, when you go to psychiatrist, they will give you tablet Serta, that is serotonin, external dose hormones has been given. Endorphins are painkiller, which is already there inside our body. And yoga practices actually stimulate that inside resource, comes into the in our circulation when requires. Okay, and like that our bhakti yoga, mantra sadhana, and right attitude, surrender attitude, antaranga sadhana, focus, meditation, all those things are actually immune booster. Actually, you know. And one more thing point which I don't know how many of know about this meditation. Many times we see the workshop is going on meditation, but actually meditation doesn't need to do anything. Meditation should happen when you listen somebody, you are completely in sync with them. That is the oneness which you can achieve. That is the state of that dharana. That is a concentration, and then that is a state of meditating. So that oneness should be achieved. Yes, for that you need to do the dharana practice. That is a concentration practices. So there are no meditative practices, my dear friends. Many people are doing it nowadays. They are running the workshop. But what I understood yoga in my 17 years of experience, that there are no practices actually. Meditative is the state where you are one with the object. And samadhi is that then you and object is not there. You are just into that completely beyond this, the body and mind state. That is samadhi. And to achieve this, you need to, practice. Yes. Then you can take the help of karma yoga, bhakti yoga, raja yoga, whatever means you want to be, when you feel comfortable. It's not even compulsory for that. So much flexible yoga is. If you feel bhakti, if you feel that state of mind when you are listening to somebody's song, that is also yoga. If you feel while practicing, physical posture, and you feel very much one with your body mind, that is also the practice. Karma yoga, skillful action. Bhakti yoga is the your the devotion, devotional state of mind. Mantra sadhana, just chanting mantra and going into that state, that is also the state. All these easy things are there. We are making yoga complicated actually. So very, very easy things, and with this we can achieve our health. Even major disorder can be literally will be dissolved, with understanding the practices. And all these the practices which I have shown here now in my slide. Here also my the message is just clearly I have written here. Perform asana connecting its physical body and emotional body. Okay. Lot of emotions we all have day to day life. We are not cleaning all the emotions. We are just carrying ahead. And for that, you need to practice yoga. Daily, you practice all this posture. At least somehow, some emotions will go, and you will feel very relaxed. And when you achieve even body posture, this kind of, some kind of advanced asana, you feel that, yes, I have achieved something today. And that sense of achievements also gives a lot of happiness. Those hormones, remember, this happy hormones release ho jata hai. So to maintain all those things, these practices, mainly I have written this. See, if you practice, I'll just explain one or two asana here. Baddha Konasana. Now here, when you sit straight, the whole flow of blood will reach towards your pelvic region, right? And even not, it will not even go to the legs, because legs are in cross leg, like this. So the whole flow is here. So if you are suffering from any reproductive disorder, or if you want to have that healthy reproductive system, you can practice this asana, because it is helping your reproductive system, your Manipur chakra, your Muladhara chakra, that is the center point of the genital tract, right? Then Shashankasana, you just bow down, means you are touching Mother Earth. You are, your ego comes down automatically. And even physically, your abdomen is getting pressure. So everything is happening. Your squeezing of the glands are happening inside the body. Massage, internal massage is happening. And that's how it is giving you health, right? Then Upavishta Konasana, then breach pose. But these are the things which you should not do. This breach pose, Sarvangasana, these are contraindicated during menstruation. So there should be customized plan, right? For yourself also, you should follow. Means you will later on give it to others, prescribe other, but first try on yourself and see the result. Then you will be more confident by taking the classes later on, right? And advising somebody. There are Bhujangasana, Naukasana, all these things, central abdomen, lower abdomen, pelvic region, back region. There are many issues which after pregnancy women suffer. Even during menopause women suffer. So to make this healthy pelvic floor, healthy childbirth, these are the space making asana. When you are in the 9th month, delivery time. So if you practice this Utkatasana, Malasana, this helps for the normal delivery. That is what I say, the space creating asana. Then normally, you don't need to go for cesarean, because you are, sending the energy to the baby and directing towards this. You are, making the contraction relaxation. You are giving the space, widen the opening of the this vagina, more good way, disciplined way mainly. Then I think there will be no difficulty. And main practice, that is pranayama. We have talked about asana. What is pranayama? It is the breathing technique, but it is again teaching you to take a pause. Okay, holding breath. But holding means what? You are keeping your oxygen and carbon dioxide both. if you are doing Antarkumbhak practice. Okay, so just these are the practices which has to be done under the master guidance, and it should not be taken randomly. Maybe it sounds very easy, inhaling one nostril, exhaling other nostril. These are the easy practice. So who are the beginners, they have to practice this first, inhalation and exhalation, and do not go forward to holding the breath. Once you master this inhalation and exhalation, then you, after your master permits you to hold the breath, then you go forward to hold the breath. Because pranayama are the practices, if it is done in a accurate way, then it gives you tons of benefit. If you don't do in an accurate way, it will give you tons of diseases. That is what Hatha Pradipika says, our yoga scripture says. Not I am not saying all those things. I am just forwarding to you what Shastra says. So we need to learn these things very, very consciously under the master guidance, and make yourself train, and then see the result. Many results are there. And now one more point, what this Hatha Pradipika says, we practice Shatakarma. You might be knowing that cleansing practices, right? Neti, Dhauti, Nauli, Vaman Dhoti, Kapal Bhati, that Ramdev Baba, you might be knowing that, exhalation, forceful exhalation. These practices are only advised who has lot of kapha or mucus in their body, and not everybody. Okay, we randomly do, advice for everybody. It is clearly written in Hatha Pradipika, if you are having some disorder, kapha disorder, respiratory tract disorder, first you cleanse that part with the help of Shatakarma. These are the 6 types of practices through which you can eliminate your kapha from the body. And then once the track is clear, then you practice pranayama. Then pranayama will be very, very helpful. Otherwise, pranayama will not give you benefit if you are carrying kapha and then you are practicing pranayama. Okay. So we need to, that's why we need to practice, the way which has been asked. Okay. But yes, for learning things, sometimes in class we have to, just to learn the technique, we may, see and we can practice once or twice what teacher teaches us. Now, yes, coming back to the pregnancy, which is very important time for the couple. So I'm just finishing in a couple of slides. How much time I have, Sneha?
Actually, we can just another 15 minutes more.
Yeah, it
Like
will
we can finish
yes.
with question answers also then.
Yes, it will be done in
Okay.
5-10 minutes. Yeah, yeah. So preparation of the couple is needed. Like I said, couple conception should not be by chance. It should be by plan. Okay, it should not be just sex hua. I did sex and I become pregnant. It's not like, it should not be like that. Should be you want to become a mother and then you became a mother. That is important things. Then it will be first impression with your new life, which will be very healthier things, connection. Okay, and couple should want it. It's not like that, wife wants to become, mother, but husband doesn't want to become a father, and they had a sex with that state of mind, then again it will cause a problem. So there is a Dr. Barker study has been given, which is called fetal oriented disorder, adult disorder. Adult way, we say that there are hypertension, metabolic disorder, diabetes, all those, the root cause is that it lies in the pregnancy and the conception. So when if you want to stop all those disorder to forward, better to be wiser first. Couple needs to be trained properly, couple needs to do yoga together and increase their bonding, and then go for increasing one more life in their life. Okay, so the cleanliness externally needed, cleanliness internally needed, and then practices also should be done first trimester, second trimester, third trimester after conception. Swami Muktananda has given the quote that doing yoga together, done collectively by both the parents, helps to create positive vibes for baby, especially pranayama and meditation. So if couple practices these things, I think somebody's mic is on and some voice is coming. Yeah, thank you. So I think so this is very important quote which couple needs to be understand before planning baby, and then during pregnancy all the practices. See, she is my student, one of my student from my class. She has done all the yoga practices during her pregnancy, and also read the benefit whatever been said, because it actually doing your care of body and mind. So even Iyengar, you might be knowing this yogi from India, BKS Iyengar. He said that body is your temple. Keep it pure and clean for the soul to reside in. So before that new soul is residing, you have to clean your body. You have to work on your brain body communication. There are many practices. Even putting oil inside the nostril is also helpful, for stimulating your pituitary gland and hypothalamus, and then these are going to act on our reproductive system. So like that, this diet, discipline and lifestyle gives you joy. In India, we have very popular movie DDLJ. So I kept this, mnemonics on that, basis. DDLJ means diet, discipline, and lifestyle, which gives you joy, and that is what we need to think for the healthy lifestyle. So one more time, namaste, thank you to everybody. Yoga Karmasu Kaushalyam. We women actually, these two things, time and responsibility, teaches us lot of things, right? Even if we have been not educated before yoga, but then also every woman, she definitely managed to overcome all those things. As much as as she progress in her life, she come across many things which she never thought of, but then also she is able to fight it very nicely, because she is Shakti, she is powerful, she has been gifted with that power of giving the life, the extraordinary power which has been gifted. And I think this gift should be more kept it in a like how we keep our gift, so very nicely in showcase, or we take care, we enjoyed. So that way we need to understand this gift which is inbuilt in all of us. So with this, I extend more power to all of you, and big thank you to Sneha. And yes, now the
We have
forum
two
is open for
questions
questions.
from
Yes,
Joy. We can close the slide maybe.
yes, yes,
Yeah,
yes, yes, yes. I'll just closing it.
perfect.
Yes.
Joy?
So, hi, doctor. Thank you so much for your information. I learned a lot today. I just have two questions. Number one, I have a friend. She is training to do the Sorry, let me remove my daughters. Sorry. So she is training to be a yoga teacher for the Lini. And then she took the vow for the celibacy, not having any sex. However, during your slides, your lecture, you mentioned that sex, one of the main reasons is to release tension. So is it healthy to take a celibacy or not? And the second question is, when I was doing my prenatal yoga, I saw on your slides, there's one move like this one. You make a, but we did that actually a lot, almost every time. Why is it bad? That's it.
So your first question is, celibacy is normal or not? What age she has taken that vow?
She's like above 30. Like
about 30.
32.
So see, in our Shastra, there are, four, sections has been done. First section is Brahmacharya. Okay. Brahmacharya means Brahma plus Charya, means the lifestyle. Charya means the lifestyle. Brahma means the universal. So we need to walk the path of the, universe, the law of nature. That is what Brahmacharya. So it should be maintained till the age of 25. 18 years is given the marriage permission for, because it's been legally permitted, but actually 20 till 25 to maintain celibacy is our duty. And then after 25, when you enter into the married life, then you should go forward for the having sex. But if you are not married, then even continuing this brahmacharya is okay, because till then brahmacharya is
for having sex.
no, this is not the only one reason. Having sex, yes, sexual. So there are, to release the stress, there are different ways to release that, right? It's not only just having sex. This is one way. So only one door is open. That doesn't mean 100 doors are closed.
Okay, I see.
There are many. Yeah. So there are 100 doors are open through which stress can be released. And yoga is one of them. Biggest tool.
Okay.
Yeah.
Pranayam is also there for releasing stress. You're saying one of them, not that this is only one for releasing.
Yeah. And your second question is Malasan. You said that you did that the posture that has actually should be done in the third trimester, because it allows your normal childbirth. The movements of the child is mainly naturally it is towards our vaginal opening naturally. Okay. And that facilitates more, and it gives a normal facilitation or just stimulation to our whole body, that the child will deliver normally in this way. So that practices has been done.
I see.
Yeah.
Thank you.
Create more space. Yeah.
I see. Thank you.
Does anybody have any more questions before we wind up? Baha?
Yes, I have a question about actually the use of tampons and menstrual cups during the period.
This is again common question. Many people ask from the Western side. Ayurveda has been, saying about using all those things for the menstruation. Blood should get absorbed. It should naturally flow further. But using tampons, somewhere we are just directing that towards that particular device, right? Blood is directed towards that device, so that is fine up to some extent, but how much you are comfortable depends on that. If you are not comfortable, it is not actually advised. When in India, we actually, if we go on Adivasi rural area, they are not even using this pad. Even using pad also not been advised as such rule of allowing that gravitational energy to flow further. So anything which we put, it should be it is against the nature. But again, we have to regulate or navigate that flow somewhere else where it should not come the barrier for our day-to-day life. And that's why it has been advised that you should not go anywhere during your menstruation. Sit in silence, sit in isolation. That was the advice which, but it is not possible nowadays, right? We are, and nowadays even advertise, if you see many tampons or any pad related advertise they are doing, it's like you can keep that so that you will be happy. You don't even feel that you are menstruating. So such a kind of social media also giving us a wrong direction actually. So it is straightforward. It is actually the holiday should be given as per your period and not as per holiday which is socially there. So that movements has to be done for the better reproductive health. So whenever the woman has period, her leave should be given properly. Then she may stay at home. Because why we are not taking leave? Because again, we will lose 5 days salary, right? But for health, it is important. I don't know how much, practically we will be able to take it. But at least one woman, if she starts from her community, it will actually give a lot of output, better reproductive health. Because this is after all national health. If you keep one woman healthy in her reproductive cycle, a lot of things can be saved later on.
True. Thank you.
Yes.
Yes. Can I ask something? I mean, it's not so much a question, but what you say, it's so nice. I mean, in a meaningful way, because I see nowadays, the last 20 years or so, it became very popular coming to pregnancy. Many women, they cannot, be reproductive naturally. So they found other ways in order to be pregnant. So from what I understood from your beautiful presentation is, if we have less stress in our life and living with respect to our needs in all subjects, the things that will flow easily, right? Because I see
Exactly.
a few friends that I don't know the word in English, you should help me, when you cannot deliver in natural, not deliver, being pregnant natural, and then you take the sperm of your husband, or how you call this?
Yeah, in IVF, IUI, in vitro fertilization.
Yes, in vitro, thank you. So what I'm trying to say is, I see many couples struggle in order to be parents, and I think has to do with the lifestyle and the stress and getting out of our natural routine. Somehow I was blessed; it was very easy for me and my husband. But I know many friends that they really suffer, and they're healthy. And the very moment they do the IVF, after the second child or the third comes naturally, which means
Yes.
they release the stress and all the tense. Huh? Am I right? Or
Yes. No, you are absolutely right. You rightly understood. Actually, all those procedure came to just facilitate this fertilization and conception, which normally people are not able to do it. Couple are not enjoying sex because of stress. Inside stress, both of them have been dealing so many things outward. Their energy goes dissipate outward. That's why pratyahara practice is very, very important, because it is again lot of things only we have. Thank God we have only 5 sense organs. I don't know how many, if it has been given more, we have been used that also. So even controlling these 5 sense organ, it's so difficult for all of us because it's consume a lot of energy. So closing eyes, so difficult. It's easy just to close, but we are not able to close completely. It takes a lot of time to be there inside us. Right?
thank you. Thank you.
Your
Thank you
voice
so
is
much. Thank you so much, Dr. Nutan. And I hope everybody enjoyed the session. And I can tell you one thing, that in the last 4-5 months, I don't get any cramps now during periods. So as I'm telling you, it's a good thing about just gaining knowledge and getting more spiritual awareness, I would say.
yes.
I'll try.
Education is healing actually. Education is healing.
Yes.
Education is not only to make our career, but it is also should be done for the healing purpose. There are many hidden factors which we don't know. When we listen somebody, almost most of the things which we can think or relate, yes, this is happening, oh this is, oh that, and then we automatically eliminate all those
Yes.
disorders from
Yes,
us.
yes, absolutely. So I will forward Dr. Nutan's slides to you guys, and if you guys want to consult her also later, you can directly, like, message her or call her, no worries.
Thank you,
Yes.
Sandra.
Okay, okay.
Thank you
Thank you
Sneha,
so
thank you
much.
all.
Thank
Bye.
you. Bye bye.
Bye.
See
Bye.
you. Bye.